In September of 2016, I started having a very long menstrual cycle. When the medication was not working, then Dr. Williams had recommended a hysterectomy. And so in January of 2017, I opted to have that hysterectomy. I worked at Lakeland Regional since August of 1997, and I had become a team leader in the medical ICU. And as a team leader, I had complete faith in our hospital. Dr. Williams had told me on my 6-week follow-up visit that it was okay to resume sex. The first time my husband and I had intercourse following that appointment, I started bleeding. Also, anytime I did anything strenuous or I stood on my feet for too long, I would start bleeding. From there, we started seeing each other on a regular basis throughout the summer of 2017, and she would cauterize me to try to stop this bleeding. She told me that the cauterization was not working and that this was just going to be a problem that I was going to have to live with the rest of my life. It was a great deal of stress, not only on myself, but my husband and our relationship. So in August of 2018, I got up to go to the bathroom and a piece of my vaginal tissue fell out and I started gushing blood on the toilet. Dr. Williams told me to see her in the office that week. When I got in the office, that is when she informed me that she had used the wrong sutures, that instead of using dissolvable sutures, she had put non-dissolvable sutures in me, and that this was the cause of the granulation tissue that I had built up, which was causing the bleeding, that the piece of my vagina that had fallen out of me was this granulation tissue as a result of that, and that I was now going to have a second surgery in order to repair my vagina and stop the constant bleeding. I was in utter disbelief. I was upset. I was at a loss for words. This hospital that I had dedicated my entire life and career to, that I had complete faith in, had let me down. Once LRMC found out that the wrong stitches were being used, the decision was made not to tell the affected patients unless those patients came back to the doctor complaining about the problems. In my case, I had already been back to the doctor multiple times and was told that I was just going to have to learn to live with this problem. After I was told that, I basically stopped going back to the doctor. So while LRMC is waiting for me to come back again, I'm suffering. A phone call from LRMC to me after they found out about the stitches would have saved me from months and months of pain and the gruesome side effects that went along with this. It makes you wonder, why didn't LRMC tell the patients the moment they found out they had used the wrong stitches for so many months?
Lakeland Regional Health knew that between the summer of 2016 and the fall of 2017, some of its OB/GYN surgeons used the wrong stitches during certain total laparoscopic hysterectomy surgeries.
If you think you've been the victim of wrong stitches during your total laparoscopic hysterectomy, go to wrongstitches.com and see if our lawyers can help you.